Imagine a surgery where the chest is open, the vital organs, that is heart and lungs, are right in front of you, and every millimeter counts, every instrument matters. Now, here is the question: what are the correct surgical instruments that make it easy for a surgeon to safely entire inside the chest without making a single mistake? Today, we are going to explore the essential surgical instruments behind a thoracotomy surgery. Before I begin, I would like to thank my best colleague, Sumaya Altafla Shari, who helped me record this video, and also thank you all for your support. Alright, before today's video on general instrument for thoracotomy, I have already uploaded a video on basic thoracotomy instruments. It is important for you to watch it because without those instruments a thoracotomy is not possible. Let's go ahead. In thoracotomy general instrument, first instrument is sponge holder. It's commonly used for grasps or hold swab for skin preparation and painting. Then we have a straight and curved mosquito artery and straight and curved crile artery. These all are commonly used for hemostasis. Next instrument is Alice tissue forceps, available in different sizes, used for holding tough tissue. Alright, the next instrument is Babcock, also available in different sizes, used to hold soft tissue like lungs. Alright, now the next instrument is peanut forceps, used to hold peanut swab. Then we have Metzenbaum curved scissor, also available in different sizes, used for tissue cutting. Now we have Metzenbaum straight scissor, also available in different sizes, used for cutting the suture thread. This is extra long, used in deep cavity. This is Mayo curved scissor, used for cutting the tough tissue. Now we have some suction nozzles used according to surgical site, the Younger suction. This is Frazier suction, and the last one is Poole suction. Alright, then we have forceps. This is Edson tooth forceps. This is dissecting plane forceps, used to hold delicate tissue like lungs. Alright, now we have a dramatic forceps or DeBakey forceps, available in different sizes, used to hold vascular structure. Alright, the next instrument is straight Hawker clamp, used to hold tough structure. Then this is curved Hawker clamp, also used to hold tough structure. Next instrument is fine long arteries. It's designed to allowing deep accesses for clamping and manipulating. Now we have golden needle holders, available in different sizes, used according to surgical cavity for suturing, repairing the structures. This is long Volkmann scope curette, used in deep cavity for scraping. Now the next instrument is right angle artery. These also are available in different sizes. Its uses is dissection, passing the ligature, and clamping the vessels. This is land tissue forceps. Its commonly uses is gripping tough structure like fascia and lymph nodes. Then what is this? I literally don't know. Could you help me? What is this? That's all for today's lecture on thoracotomy general instrument. I hope you learned something new. If you have any query, you can ask by dropping comment or direct message by my social media account. We will meet soon in our next interesting lecture. Stay connected with us. Thanks for watching.